In today's episode, we are going over an evidence-based guide to physical therapy rehabilitation after arthroscopic rotator cuff repair surgery. Let's do it. All right, so what's the problem with rotator cuff repair surgery? Well, first and foremost, rotator cuff related pain is the number one most common type of shoulder pain reported in the medical literature. It is extremely common, and therefore the repair is actually common as well. One of the issues with rotator cuff repairs is that they will often re-tear, and the rates are highly dependent on the type of tear. However, in some studies, they're as high as 94%, right? So essentially, almost 100% of all rotator cuff tears in some studies will re-tear over the course of time, right? And this is not common for the majority of rotator cuff repairs, obviously, but it does end up getting a little alarming from a physical therapy standpoint because we actually do know that what we choose from a physical therapy perspective to do with our patients will influence their outcomes and also influences whether or not they re-tear over the course of time, right? So if I go too fast, am I going to cause a re-tear? If I'm not going fast enough, will I not facilitate healing, right? What should a physical therapist do? The other piece that becomes very, very confusing is that there's a huge variance in different protocols in patients that have rotator cuff repair surgery. You may have one patient that comes in and the physician has no sling on the patient and active range of motion starts at, let's say, 4 weeks. And you might have another patient that comes in at week 10 and they were in a sling for 6 weeks and they're not allowed to do any sort of strengthening until they get to month 3 or month 4 even, right? So there's huge variance between different protocols. And the other piece is that the medical literature is relatively clear in the sense that some tears can potentially be pushed a little faster than others. So it's not just like every single rotator cuff tear repair should be treated the same, right? And the thing is, as physical therapists, we want to try to optimize our outcomes. We want to minimize the risk of re-tears. So how the heck should we go about this? What should physical therapy rehabilitation look like? And what should be those differences from patient A to patient B with different size tears, different occupations, going back to different sports, et cetera, et cetera. So in today's episode, we're going to go over outcomes following rotator cuff repair surgery. Does the surgery work well? Are patients happy, satisfied? Do they get back to their sport after they finish up getting the repair surgery? Should you immobilize and put a sling on the shoulder following rotator cuff repair? When should you initiate range of motion exercises? And this goes for passive range of motion as well as active range of motion. Is there a difference between accelerated physical therapy program and more standard or conservative programs? What are factors that are going to influence the rate of progression and also healing rates? And lastly, what are return to sport times and rates? Are people returning back to sport? Are they getting back to the same level as did before? Is there a difference between different types of sports, right? And lastly, how about barbell athletes? So the folks that we love working with, as physical therapists that really enjoy strength and fitness. Now, before we really get going, I want to let you know about a free resource. I have made a rotator cuff tendinopathy and rotator cuff tear evidence-based cheat sheet for you to check out. It's 100% free. I'll put a link in the show notes. You can check it out. We go over rotator cuff tear prevalence, anatomy, the difference between a tendinitis and tendinosis. We go over risk factors for tears and tendinopathy. We go over the clinical presentation, common tear types, rehab expectations, as well as surgical candidates. So who is the best candidate for rotator cuff repair surgery? Because not all folks are going to need surgery. So we'll go over all of that in this cheat sheet. I'll leave a link in the show notes, 100% free. Go grab it. And welcome to the Fitness Pain Free Show. This is where we help coaches and physical therapists like yourself get your patients out of pain and back in the gym where they belong. My name is Dan Pope. I'm a physical therapist. I'm a coach, personal trainer, and a meathead. I love all things fitness. I have my dream job as a physical therapist, coach, business owner, and educator, and I've been doing it for a few decades now. My goal is to help you reach your goals so you can be as happy as I am. Now, I want to put a little standard disclaimer in the mix here. If you are an individual that just had rotator cuff repair, this is in no ways a guide to your rehabilitation, all right? You definitely want to try to get guidance from a physical therapist or surgeon. Do not take my advice. Do not go ahead and just do everything that I talk about here today. I think it's very important that I state that. The second piece is that I am not going to include a protocol here. This is not going to say week 2, start this, week 4, start this. I'm really kind of summarizing the evidence and just helping you to critically reason as a physical therapist or coach to try to figure out what's best for your patient, right? If you want some really good in-depth information on how to treat rotator cuff repairs, I highly recommend you checking out anything from Kevin Wilk. I call him the rotator cuff repair master. He has a ton of great courses out there, lots of good free information as well. Go into Google, throw in his name next to rotator cuff. You'll find all sorts of great stuff. And lastly, if you do want a decent protocol, I find myself recommending the protocols over in the University of Delaware quite a bit. And I'll leave those protocols as a link in the show notes if you want to check that out. They have a bunch of really good protocols for rotator cuff repair. This is part 2. If you haven't checked out part 1, I'll leave that link in the show notes. Go check it out now. So, early versus delayed motion after surgery. So, in order to try to figure out an answer to this, I took a look at a study by Xu Zhang et al. In 2018, and that was looking at 8 different trials of 671 patients. And they were doing early versus delayed passive range of motion. And the way they defined the passive range of motion was essentially performing passive range of motion less than 2 weeks from surgery. And then the delayed motion group was performing passive range of motion greater than 2 weeks, right? So essentially, early guys did passive range of motion, started somewhere between 0 and 2 weeks. And the delayed guys did passive range of motion started after 2 weeks, right? So in the early protocol group, they actually had superior range of motion. However, that may adversely affect the shoulder function. So the folks that were in the early protocol, they tended to have a little worse outcome, right? And the last piece that was actually very important is that the early passive range of motion might result in lower rates of tendon healing with large size tendon tears. So in the small to medium tears, this might not be an issue, but in those larger tears, it looks like it may be a concern. So what the heck were they calling passive range of motion in these studies? So if you're watching this on YouTube or the video podcast version of this, I put up a really nice chart or table here, which shows what these studies were using and calling passive range of motion. I'll just read off the first study because there's multiple studies included in this main study. So essentially, the early passive motion group was allowed to perform pendulums, manual passive range of motion. They also were using a CPM machine and they had no restrictions whatsoever in terms of how far they're allowed to bring the shoulder. So there's no limitation in the flexion range of motion, external rotation range of motion. Just go for it, basically post-op day 2, right? Now, in the delayed passive range of motion group, these folks were actually doing a little bit of passive range. They were doing some pendulums. They're also giving some hand, elbow, and wrist range of motion exercises, right? So when you're looking at the passive range of motion group that did passive range early, they just had more range of motion, right? In the delayed group, they were actually doing some passive range initially. It's just that they had to wait a little bit until they had a physical therapist move their shoulder a little bit more, okay? And this was pretty consistent with the rest of the studies, but take these big meta-analysis with a grain of salt, just because they're taking a lot of studies together and they're just trying to figure out which studies use this kind of early passive range versus delayed passive range. But the definitions of passive, the exercises used when they're allowed to start them versus how long they delay them for, very different from study to study. So guys, if you like what you're learning about so far, then I want you to go and check out the Fitness Pain-Free Mini Course. So I made a mini course. It's absolutely free. That's the next logical step if you want to learn more from me. So in the course, we go over 5 lessons. That first lesson is how traditional schooling has failed us, right? So schooling is phenomenal from a physical therapy perspective, but doesn't really teach you how to work with high-level athletes in the fitness world, right? Doesn't always teach you how to do the lifts appropriately. Doesn't teach you about progressions and regressions of common lifts within the gym. Doesn't teach you how to program normally, how to write rehab programs, or how to write injury prevention programs for these folks. Next thing we go over, 7 reasons why people get hurt in the gym, 4 simple steps to getting your clients out of pain, how to build the career of your dreams and earn the respect of your community. It's all well and good if you know exactly how to work with folks within the gym. But if you can't get these folks through the door on a regular basis, then you're simply not going to be living the dream that you want to, because you can't get the patients through the door that you want to work with. Okay, so I'll show you how to do that. And lastly, we'll talk a little bit about the Fitness Pain-Free certification, right? So I'll leave a link in the show notes. I definitely recommend checking this out. Once you sign up for the Fitness Pain-Free Mini Course, you will be automatically placed in the waitlist for the Fitness Pain-Free certification. Now, the Fitness Pain Free certification is the course, the certification that I wish I had as a new grad that fills in all the gaps in knowledge that you don't get in physical therapy school. So, A, you'll gain complete confidence working with injuries in the strength and fitness world. You'll learn optimal technique for both health and performance from myself and some of the best coaches in the world. You'll master programming for rehabilitation and injury prevention. Have fun while earning a whole bunch of physical therapy and physical therapy assistant credits. You have 31.5 of those. You'll also gain NSCA credits as well as CrossFit credits if you need those. This is the equivalent of a university education in working with injuries in the weight room. I really believe that. I've been adding to this thing over the past 5 or 6 years. It's massive, a ton of phenomenal information. And lastly, the biggest goal is just to fill your day with the patients you love working with and building the respect and admiration of the communities you love working with. So I'll leave a link in the show notes. Sign up for the Fitness Pain Free Mini Course. The certification is open 4 times per year for 1 week to enroll into. If you're on the wait list by signing up for the Fitness Pain Free Mini Course, I'll alert you when that next enrollment period is open and you can get started. Let's get back to the show now. Next was a study by Saltzman et al. In 2018, and he was also looking at early motion versus delayed motion. And he found pretty much the same thing. So they both lead to comparable functional outcomes and re-tear rates. So essentially, if you do early versus delayed passive range of motion, kind of end up in the same place long term, right? The other thing that they did find was that early motion may result in greater re-tear rates, particularly with large tear size. So similar to the last study, and one thing that we have to be on the lookout for as physical therapists is if you're working with a larger rotator cuff tear, chances are you have to slow things down a little bit. Matlick et al. In 2021 also tried to answer this question. And essentially, they were looking at 13 studies, right? And 6 of those studies favored early mobilization. So early mobilization groups had improved outcomes, greater range of motion up to 6 months, postoperative reduced pain levels, and reduced postoperative stiffness. The other 7 studies demonstrated no significant differences in outcomes. So just to summarize this information, it seems like in some studies, doing earlier passive range of motion is going to be beneficial with range of motion, pain, and stiffness. In some of these studies, it shows no difference between groups. And the other piece is that in larger tears, you may end up increasing re-tear rates, but that might not happen in small to medium-sized tears. So what's the difference with accelerated versus conservative rehabilitation programs after surgery? So Longo et al. In 2021 set out to answer this question, right? So he's looking at a lot of different studies. And the definition of conservative rehabilitation was basically having complete immobilization of the shoulder for 6 weeks, right? So that's a very, very conservative approach. Basically, don't do anything with your shoulder, put it in a sling for the first 6 weeks, right? The second group was called the accelerated rehabilitation group, and they gradually reintroduced movements before the 6th week. So group 1, don't do anything for 6 weeks. Group 2, do stuff before 6 weeks. Is there a difference in outcomes? So I think it's important to actually talk about the type of tear that was in this study. Like we said previously, there's a difference between a small rotator cuff tear and a large one. So in this study, they were looking mostly at full thickness rotator cuff tears. I went back and tried to look into some of the studies that were cited in this analysis, and I couldn't find the types of tears in every single study. There's a lot of them, but largely it looked like we were dealing with full thickness rotator cuff tears, right? And what's also a little confusing is that active mobilization was started at different time points in different studies, right? So in some studies, 2 of the studies included in this particular meta-analysis, 2 of these studies, folks were able to perform active range of motion immediately after they've had surgery, right? 2 of the studies were able to start performing active range of motion at week 3. And 2 of the studies, folks were able to perform active range of motion at week 4. One of the studies, folks were doing active range week 5. 4 of the studies, active range at week 6. And 3 other studies were unspecified, okay? So again, this actually makes it pretty challenging to look at this meta-analysis and get a lot of meaningful information from it, just because they're taking protocols that are having people start exercises, different exercises at wildly different times, okay? In this same study, folks were starting strengthening exercises in different time periods as well. In 4 of the studies, folks were starting strengthening somewhere in the 4 to 6 week range. In 2 of the studies, they were starting strengthening in the 8 to 9 week range. In 3 of the studies, they started strengthening at week 12. In 2 of the studies, they started strengthening at week 16. In 3 of those studies, they started an unspecified time. All right. So we get a general idea of early versus delayed in this study. But the other piece is that you have to take these studies with a grain of salt just because everyone's starting their active range, their passive range, and they're strengthening at different times. So it's really hard to tell what aspect is leading to a poor outcome or good outcome. So overall, what did they find? There was no statistical significant difference in the re-tear rate among the accelerated and conservative groups. There was improved external rotation at 3 and 6 months of follow-up in favor of the accelerated group. So a little bit better range of motion in the accelerated group. Once you adjust this data for the tear size, particularly in large tears, large lesions, there is increased number of re-tear events in the accelerated group. And tear size may influence the early postoperative rehabilitation outcomes for tears that are large, so 3 to 5 centimeters plus, right? The other piece is that this evidence was mixed. So large tears in accelerated groups in some of the studies had a greater re-tear rate, and then large tears in other studies with the accelerated group had the same outcome, right? So I think that's just important to keep in mind. However, this does kind of tip my hat to the thought that, all right, if you have a large tear, maybe we're not going to go as accelerated because if we delay things, it's probably going to be a little bit safer. Tire 4 in 2019 also tried to answer the same question. What was good about his study is that he was looking at partial thickness rotator cuff tears. Now, in the last study, the studies included were majority large, full thickness rotator cuff tears, right? However, partial thickness are different. They're a little bit smaller. And what you'll see is they tend to do a little bit better. They have a lower re-tear rate. Generally speaking, I think they have a little bit better outcomes, right? So what happens, accelerated versus conservative treatment of these partial thickness rotator cuff tears? And what they found was that in the accelerated group, they had significant improvements in active range of motion, both at 6 weeks and 3 months. They had less postoperative stiffness, and there was no evidence of a higher rotator cuff re-tear rate. Okay. So in my mind, what this gets me to start thinking is that if you have smaller tears, especially if they're partial thickness tears, after you have rotator cuff repair surgery, we can probably go a little faster with these guys. We can go with a more accelerated program. So in this study, what was the accelerated PT protocol? Like I said, these research studies include so many different studies with different protocols. It's really hard to put your finger on what's okay versus what's not okay, right? So in the accelerated PT group, they use a sling with abduction pillow, and they use it during the daytime for 4 weeks. And at nighttime, they use it somewhere between 2 and 4 weeks, and then it was discontinued afterwards. In the standard PT group, they were using the sling for 6 weeks continuously. In the accelerated group for passive range of motion, they started passive range of motion 2 to 4 weeks, and they utilized pendulum exercise to start, right? In the standard PT group, they used exclusively passive range of motion for the first 6 weeks in the form of pendulum exercises, right? So in the accelerated group, they began active assist range of motion weeks 2 to 4, whereas the standard PT group was doing passive range for 6 weeks. They didn't begin active assist range of motion until they got to 6 weeks post-operative. In the accelerated PT group, they were beginning active range of motion at the 4 to 6 week mark, whereas in the standard PT group, they were starting active range of motion in the 3 to 6 month period, which is actually a very long period of time to wait to start active range of motion exercises after rotator cuff repair surgery. So I think in some ways, this study is not fair from that standpoint, just because the standard PT protocol is so conservative, whereas the accelerated PT protocol is accelerated. But if you compare this accelerated PT protocol with the more moderate standard PT protocol, you might not see these same differences. And lastly, in the accelerated PT group, they were beginning strengthening at 6 to 8 weeks post-op, and they had no restrictions after 8 weeks. In the standard PT group, they were beginning strengthening exercise at 3 to 6 months post-operatively. Again, that is mega conservative. So take this information with a grain of salt. If you had a more moderate standard PT protocol, you might have similar results to this accelerated protocol. Who knows? If you guys are liking what you're listening to right now and you want to continue with the rolling, I have another video for you. It's called When Do Rotator Cuff Repairs Fail? So, unfortunately, a chunk of these rotator cuff repair surgeries will fail, right? And it's important as physical therapists to know when these are actually occurring so we can be a little bit more cautious during this time period. So, I'll leave a link above my head and go ahead and learn a little bit more about when rotator cuff repairs fail after surgery. Lastly, I just want to say thank you so much for your support. You truly allow me to do what I love for a living. If you're watching this on YouTube, hit that like button, leave a comment for me. I'd love to hear your thoughts on this, and subscribe to the channel. It helps me out tremendously. If you are listening or viewing the podcast version of this, please leave me a positive rating and review. Helps out tremendously, allows me to continue doing what I love to do and helping you guys out in the process. If you want to go that extra step in supporting me, consider subscribing to Insiders. What's Insiders? It's a comprehensive educational resource and toolkit for the fitness and rehab professional. All this content is produced by me. Think Netflix, but for trainers and physical therapists. It's premium content similar to this podcast, but more in depth. If you really like what you're learning from Fitness Pain Free, this is that next step to go deeper with your learning. I've been updating it monthly for the past 5 years or so. There's a tremendous amount of information in there. You've got over 100 webinars, ebooks, and complete guides. You have access to a private Facebook group where you can have all of your questions answered by me. You can decide upcoming podcast episodes. It's cheap to get started. There's a $1 1-week trial. Afterwards, it's just $10 a month. And lastly, you can cancel anytime. So if you want to get started, I'll leave a link in the show notes, or you can head over to fitnesspainfree.com, click on the programs link, and then click on Fitness Pain Free Insiders Online Library to get going. Lastly, if you want to check out any of the references, I'm going to leave those in the show notes as well. You can see exactly where I'm getting this information from.